Welcome. This is a broadcast just for you and your loved one, because today we're going to be talking about Medicare. Yes, Medicare 101. But before we get started, I need to make sure you're doing what? That you're taking care of yourself each and every day as a caregiver and as supporters of caregivers, that you are taking care of yourself and that you are also making the safest and best decision for your loved one, and that you are also creating a support system. So if you're doing those things, then hey, you are on the right track to winning this journey and being a successful caregiver. And if you're not, just go ahead and get started. That's right. Just go ahead and just start taking care of yourself. Go ahead and create that support system, and go ahead and make sure you're making the safest and best decision for your loved one. Is that good? Welcome, everyone. Hello. I see Donna. I see Carol. Thank you all for joining. Please go tag other family members, caregivers that you know, your co-workers, everyone, and let them know, hey, hubby, that's my hubby that joined. Hey, and let everybody know that Bridget is going to give some good details today, okay, on this show, Keep Living in Your Right Mind. Thank you, Bridget, so much for being here.
Thank you for inviting me. I always love to come get some information to you and your group. Always. Always.
Bridget Long has a financial company business. She's a certified insurance agent. And so she has a lot of knowledge and expertise in this field. And so many of you know that we've had Bridget Long on our show before. She is also one of our admins in our Facebook group. So, Bridget, I'll just let you take it away. And you want to give any additional information about your history or background, and then we can just dive into Medicare 101.
Just briefly, I've been in the financial industry over 20 plus years, and it's ranged from insurance, real estate, and I teach financial education. Right now, my focus is I am a licensed independent insurance broker, and I specialize in Medicare and life insurance. I do a lot of education in the community in terms of teaching folks about Medicare and the things that you need to focus in on. I know a lot of folks always say, well, I'm too young to know about this. Well, you're not, because I'm sure you have family members, parents, that you may need this information for, but you also need it for yourself to prepare you in the years to come, because there's some things about Medicare that you just wouldn't know on a regular. So if I can help you stay away from penalties down the way, then that's something that you definitely want to know, because it was new for me coming in, and I'm thankful because I've been an entrepreneur since 2006, and I needed to know these things, and I definitely wanted to get the information out to you all. So that's that. Do you want me to move into?
Yes, okay. Let's go ahead and just dive into what is Medicare.
Okay, very good. What is Medicare? Well, Medicare is insurance for people. Now, you have a breakdown of who it is for. It is for those that are 65 or older, and then you have some that are under 65 that have certain disabilities. And normally what happens is you have to be on disability for 2 years. After that 2-year mark, which is the 25th, they call it the 25th month, then they go over to Medicare. And some of those folks, they look for, agents to help them maneuver so that they can understand what their options are. Then you also have folks that may have been diagnosed with ALS, which is also the Lou Gehrig's disease. There's no waiting period for that. And then also anyone that is affected with end-stage renal disease, no waiting period for that as well. And then that's at any age. So you may see some individuals that are very young and they say they have Medicare. It could be due to their disability or what they have been diagnosed with.
Okay, that's good to know.
And then also, in order for you to get Medicare, you definitely have to be a U.S. citizen or have been in the United States for at least 5 continuous years. Then let's just talk about how do you qualify for Medicare? Originally, there are the original Medicare, which if you've heard this term before in commercials, you have Part A, Part B,
yes.
and everybody's like, what does all these letters stand for? Okay, well, Part A is basically your entitlement. When you think about your payroll check and you see all these taxes coming out, well, one of them is FICA, which makes up a contribution for your Social Security and your Medicare. So this is when you're getting ready to retire. So, like I said, that Medicare. So Part A, which is your hospital insurance coverage, that's considered your entitlement because you paid into the system. You and your employer had paid into the system. So after working at least 10 working years or 40 credits, is what they say, then you have a premium-free Part A coverage, which takes care of you going to hospitals.
Okay.
And so now if you do not have those credits, you're going to be stuck with a premium. And the premium can either be $278 or $506. It just depends. So that's something you can look into if that was the situation. But normally, if you have those 10 working years or 40 credits, that's premium free. Now the next one is Part B. That's going to make up your doctor visits, outpatient surgeries, when you're going to see a nurse, anything like that, office visits. That's your Part B. And Part B comes with a premium. So right now the premium is for a single individual is 90. If your income is less than $97,000, you're gonna pay $164.90. Now, if you're married, it goes up to $194,000. It'll stay at $164.90. And so as your income goes beyond that point, is different figures, and I think the highest is $500 plus odd dollars. It's a chart on Medicare.gov that'll tell you, but you definitely need to know the initial what it is, and that's what it is for that. So Part B, that's what you're gonna have, and A and B makes up just original Medicare. And how that works, because if you've heard some of your parents, you're gonna get a blue and white card.
Yes.
And normally you go to any provider that accepts Medicare. And so if you just have original Medicare, what happens is Medicare pays for 80% of everything, and then you're responsible for 20%.
Okay.
There is no limit. So say, for instance, you go and you have a heart surgery. Medicare pays for 80%. You start with 20%. So think about that in your mind and your head. And what if the surgery is 100,000 plus? And in this age, probably more than that. So Medicare will pick up 80%, and you have a bill for 20%. So now, what will you do?
Yes.
Do you have that laying around
somewhere, right?
Some people have that. We don't know. But if they don't, you need to know that you're going to have a percentage. And then this does not cover your medications. So in order, what you have to add, and they may not tell you, is that when you're eligible for Medicare and you get in your Part A and Part B, you also have to add a prescription drug coverage, which is considered Part D. And if you don't get it when you're first eligible, you'll have a penalty of 1% until you get into a prescription drug plan. And just to give you a example, I had a client that was a school teacher. And, she ended up deciding, went a different career path. And so she ended up, getting retired, just had Part A and B, and never did do anything else because nobody told her. She just signed up for her Medicare because that was her benefit. But she started listening, which most of them do, to family, and said, hey, I get a food card. I get this on my plan. You don't get this. And so and I'm about to talk about Medicare Advantage. So that's what our family member had, was a Medicare Advantage, which is Part C, and I'll tell you about that shortly. But she never did get Part D, which is prescription drug. So once she got to me and we talked about her options about going a different route, I had to educate her because she had gone years without having Part D, which is the prescription drug coverage. Now she was penalized, and they don't care that you don't know.
Wow.
They don't care. So what they do is they go back to when you were supposed to enter into the system in terms of your Medicare, and then they take the average of what a Medicare Part D coverage is, and they parade that and calculate how much you need to pay. And it ended up being 30-some odd dollars after everything, because it's 0.1%. That would never go away. You're going to pay it as long as you have Medicare.
Wow, let's slow down for 1 minute, because that's some good information, some good details that I did not know myself, and I don't think a lot of us understand that. So once you are eligible for Medicare, if you have put in 10 years, you have those 40 credits, and if you don't know that information about yourself as you get older or about your loved one, you can go to Medicare.gov?
Yes, you can go to Medicare.gov, and I also say set up you a SocialSecurity.gov account, because it'll take into account all the monies you've made, and you'll see all of those credits, and it'll tell you where you're at. I always post that. I posted on my business page, Bridgette Long, MPA-Destiny What Solution. I post stuff like that so you can set up your free account, because you can track it and follow it. And then you can also, once you get into Medicare, you can look at claims on there as well. But yes, that is correct. And there is also a penalty if you do not get into Part B. But we can talk about that, because if you decide to stay on your employer plan, that's considered credible coverage. And as long as you are in a credible coverage, you can delay getting to Medicare. But then you can review both side by side to see which one is going to be the better fit and less expensive. But you have to make sure, if you decide not to be in your employer's coverage, that if you don't like the Medicare side, can you come back? Because if you can't come back, it may be a consideration. Do I want? But what I have seen, most people keep the Medicare side, but it depends on your lifestyle and what works best for you. But what you do need to know is that there are some parts that you have to consider. If you're going to delay them, it must be a credible coverage situation. Otherwise, you'll be penalized for not getting in.
Wow. So it's your responsibility, not your employer or your previous employer, not your doctor, not your social worker, not your therapist. It is your responsibility to make sure that as you continue to gracefully age, and for your loved ones, that you go to Medicare.gov, log in or create an account, and look at your particular benefits, what's available for you, and then understanding. And I think I'm stuck on the penalty. I just want to go back over that one more time. I don't like that. I don't like that. Because if you are eligible and you have traditional Medicare Part A, Part B, but then you yourself did not add Part D, you are penalized 1%. Yes. So how long do you have to add Part D before you start getting penalized? Is that
when you first become eligible, it's a 7-month period. Okay. So they will reach out, see you 3 months before your 65th birthday, if that's where you at, to let you know you're coming upon the season, the initial coverage enrollment period. You got 3 months before, and 3 months during the period of your birthday, and 1 month after. So it's actually 7 months all together. Okay.
That's the 7 months.
7 months period. Okay. So after then, you're going to have to figure something out.
Right.
Unless you have credible coverage. Like if you don't, you may decide, like I have a family member that is still working, but she has her Part A, which pays for hospital coverage. You can get that all day long, and then keep the rest of it with your employer because most people a lot of people are still working at 65.
Right.
So they've decided to delay it, and you're fine as long as you have coverage that is at least covers as much what Medicare covers, and they consider that credible coverage.
Okay.
That you have a doctor's that covers doctor's visits and your prescription drug, as long as credible, and it will. And then for 2024, COBA is going to be considered credible. Okay. So, and that's the thing, and you have to ask them. And when you talk about employers, a lot of times the HR professionals, they know some parts, they don't know all it is to know about Medicare. And that's, I am looking to really get into a lot of the human resource offices to do Medicare talks for their employees, and then also for the HR representatives to understand as well. Because a lot of times they give them paperwork and send them on their way, and nobody knows. You see a lot of unions that educate their members, or certain trade organizations that do, but just regular professional outfits, you don't see it. Some of my other colleagues have been doing some things with some companies to help their employees understand. So if you know that you might want to see that, or offering with your HR office, please reach out to me, because I'm willing to do that. Because a lot of times, they know some things, but they don't get into a lot of in depth of how Medicare is work, how to sign up, and will it even make sense to do something? They don't have time. They just don't, and they would rather somebody else do it. But those are the key pieces. Now that's original Medicare.
Okay.
And then the second way to get Medicare is, if you heard, Part C. Part C makes up A and B, which is your hospital. A is your hospital coverage, and B is considered your doctor's visits, all the other things outside of the hospital. Now C, like, it has to encompass A and B, but then C is like your all-in-one type alternative, what you're familiar with if you're working with through your employer coverage.
Okay.
It is kind of like a bundle, because if you just heard me A and B, you didn't hear me say anything about dental.
Yes.
You didn't hear me anything about vision.
Vision, that's right.
You didn't hear anything about dental.
Right.
So original Medicare doesn't cover any of that. It just covers what I just said. So now your C, which you'll hear of commercials, or if you get calls, those are going to be considered your Medicare Advantage plans. Those are through private insurance carrier. If you've heard, it's going to be the class Humana, Aetna, Anthem, it's a couple of others, Clover, Cigna, they all have Medicare Advantage plans. And so what happens is, you got to look at what fits your lifestyle. If you're used to that type of coverage, and that's something that you want to continuously to have, and also being able to monitor certain aspect of your health care, and you don't want that to change, that may be the route you want to go. And then also, it has some control of your out-of-pocket expense, versus Medicare is unlimited in terms of how the expenses will be, because they only pay 80%. You're going to be 20%. Whereas the Part C is going to mimic employer coverage, where you're going to have a maximum. What's the maximum out of pocket that you will spend? And that could be for a policy. It could be, I'm just throwing a number, it could be $6,000. Whereas Medicare on the other side, original Medicare, it could run the gamut. Depends on what you got going on.
Right. Depending on your condition.
Conditions, sick, things like that. Whereas the Medicare Advantage side is a maximum out of pocket. And then on top of that, it's going to include, most plans will include your vision, your dental, some do hearing aids, and then some even get even fancier. You're going to have food cards. They give you credits for food cards to pay for healthy foods, over-the-counter drug that you may need. They may provide transportation services to and from doctor's office, dental visits, things like that. And then another attractive feature may be they offer gym memberships.
Okay. So has Part C always offered those additional options like healthy food choices, gym memberships?
Not always. What you will see every year, you're going to see different value-added benefits.
I see.
So that's why October 15th, starting October 15th to December 7th, which is the annual enrollment period, you want to get a plan review because things can change. Your health condition can change, or even your financial situation can change. And you may say, well, what's available for me this year?
Right.
Because last year I enjoyed such and such and such and such. With this year, and with groceries growing up, that helps a senior with their grocery bill to have those food cards. And some of these cards also they can use toward their utilities, cell phone bill, all different types of things.
That's good to know.
All different types of things. And while I'm talking about these, let me read this disclaimer as well while I'm talking about Medicare Advantage. We do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all of your options. Anytime we talk about Medicare Advantage, we have to make sure, you'll see commercials, but we have to make sure that we let you know that there is a limited amount of options. I discussed a couple carriers, but it's several others, but it also depends on your area. So let's just make that clear of what's available.
Awesome.
But now, like I said, so 2 ways to get Medicare: through original Medicare, which is A and B, and then Medicare Advantage, which is Part C, which encompasses A and B and C. And then also these Advantage plan also cover D. So if you see here MAPD, which means that D is going to have a prescription drug coverage, whereas original Medicare doesn't have it, and if you don't get it in time, you'll get penalized. But most Medicare Advantage plans will have your prescription drug, but there are some that do not. So you have to make sure if you need prescription drug coverage, let's get it. Like I talked about my previous client, what she was doing, because Walmart had a really inexpensive generic plan. That's what she was getting her drugs through Walmart, because she just simply had like a blood pressure. And so it was really cheap. So she never thought about it because she didn't need it. However, she didn't realize that because she was not in a plan, she will be penalized later, because she was like, hey, well, I didn't have a lot of drugs. And some people may have a lot of drugs,
Well, does Medicare send out any notices to anyone that is eligible for Medicare to let them know that particular window that they need to actually sign up and get Part D? Is there any type of notifications that go out?
Normally they do send information, and I know a lot of times folks get so much mail that they don't pay attention, or they just simply throw it out. But they do let you know, like I said, that 7-month period prior to, they will let you know prior to your birthday, 3 months before. They're going to let you know you're coming up on your 65th birthday.
Okay.
So you can sign up now, or you can sign up by your birthday, and telling you when it can start. So you do know some is limited information, but I think it's not so blatant that when you read it, that you really understand that if I don't do this, then, and if you are still working, you may say, well, I'm just going to wait. But you can still get your Part A and just delay your B and D. If that's, because you're still working and you have credible coverage. But it's some people, I have a couple clients that are still working, but they're on Advantage plans or, what they're doing because it was less expensive going the Advantage plan because it was too much at their employers and they were single and they was like, that's a big, that's really cutting into my paycheck.
Right. Where
I can just pay my Part B premium and give me an Advantage plan, and that's all I'm paying. And most of the Advantage plan, there are quite a few of them. The Advantage plan, there's zero premium. You're not paying anymore. Now, there are some that do have a premium, and it offers, some more robust type of coverage. But on average, they normally are enough to do what you needed to do on the regular.
So that premium that you're referring to, that's $164.90. $164.90. You are paying that when you have Part C?
B.
When you have Part B.
Mm-hmm.
So when you add Part C, if you would like to add Part C, what are you paying?
You will still pay great question. With Part C, you will still pay your Part B premium. And in order for you to stay in your Part C, which is that all-in-one type bundle where you're getting that robust type coverage, you have to still pay your Part B. Okay. And that's $164 because it's making up A and B. So it doesn't take any away. So you still have to pay your Part B premium based off your income, whatever it is. But if you're below that amount of $97,000 or less as a single person and $194 as a married couple, you'll pay $164.90, and that's as of 2023. Don't have the figures for 2024, but that's 2023 figures. So yes, you will still pay your $164, and most of the plans, the Advantage plans, they normally will be zero premium, but there are some that do have an additional premium, and you can make that choice of whether or not you want to do that. And you can always, when you're doing your reviews, and I normally look at about 2 to 3 based off the client situation and say, based off of what you told me, do you travel? Do you, what are you looking for in terms of most people? They may say, hey, I need dental. I want dentures. I want, stuff like that. So I give them a form, what's important for them, and I look at that, and then we compare the plans based off of their area, what comes up. But yes, you will continue to pay your Part B premium. That does not go away. If you stop paying it, you will not have Part C. Okay.
So if your income is $30,000, that's your annual income. How much will your Part B premium be?
$164.90. It is 90.
Y'all saw how she said that to me. Like I told you before, $164.90.
It's 97 and below. If you go, and that's as a single individual, and if you go beyond that, you go to that next tier of whatever that is. But yeah, it will be $164.90. However, that's a good point that you brought up, and I'm gonna go into.
Some people may not be able to afford $164.90. $164.90 may seem like a lot for some people.
That's a great point.
Yeah,
thank you, because I have that as my notes, and what I'm gonna go into for those that, and this is critical. Critical. You don't have a lot of folks that know about this, nor do you, have agents that may, get into it with some of their clients, because a lot of times financial information for some folks is very sensitive, and I get that. I've been doing financial education a long time, and I try to be very sensitive because some people just don't want to discuss. They however, you do yourself a disservice because it's a lot of help out here, and you want to know what's available.
Yes.
So again, going back to your point, thank you for pointing that out. If you are one of those, and it is definitely not 30,000, because that's a little bit more, but there are Medicare savings programs that are available that will help you pay your Part B premium and your Part D. for your prescription drug. So the reason why I'm saying is because I always tell folks, is there a question on my sheet is, do you need help paying your prescription drugs? Is there do you ever have an issue with paying for food or anything? And the reason why I ask that the way I do, and some answer and some don't, is because I'm trying to figure, do I need to give them information about these Medicare savings programs?
Okay.
Because what happens is I will help you get the link so that they can apply for Medicaid.
Okay.
What happens is, if your income is below a certain level, there are certain different levels and categories that they can put you in, where they may pay for all your Part B, your Part D, any other premiums, and it just depends on your income, where they will take care of all that, and you'll have zero anything. You won't pay for anything. And they can, I won't get too technical because it's too much. It's called a qualified Medicare beneficiary, and that's the QMB. That's what we call. Then you got QMB Plus, Slim B, and all that. That's our acronyms. That's way over your head. But it's worth it to apply to Medicaid so you can see if you are eligible and at what level. Because it could be they just pay your Part B, and then, you get everything else you're responsible for in terms of just you. If you had an Advantage plan and they take care of your Part B, well, then you're out zero. And then if you have your Part A entitlement, then you're not paying for anything. You could be that you get extra help, which means that they'll pay for your prescription drug coverage. So meaning that, okay, if you're on an Advantage plan and it has prescription drugs in there, well, when you go to the pharmacy, they will pay for your drug costs.
Okay.
Now, that could be at a different level as well. It may pay for all of it, or they may pay for a percentage of it. But it's worth the shot to apply for it so you know. Because when you go and apply in Medicaid, they're going to automatically run you for everything to see what you end up coming up with. And the only way for you to know is for you to apply. Because people hear Medicaid and they just say, I don't want to do that. They get in my business. It's not about that. It's about when you have a senior or anyone that is on a fixed income.
Yes.
Every little bit helps. Because you have folks that are rationing out, I'm going to take half of a medicine because I don't have enough to go to the pharmacy, to buy some more.
Right.
Or if they also get prescribed a particular drug that may not have a generic, or the doctor is saying, I want you to be on this specific one, and that specific one may be $200-$300. We got to come up with something. But I have also troubleshoot with some of my clients to say, look, they may have given you, and mostly I see it in the diabetic drugs. They may have given you this, but there's something else that the doctor can come up with that is similar. So we've had to troubleshoot with the doctors. A lot of times they're just so used to writing a script. This is but what else is comparable that can do the same thing so that we can get it that it's affordable. I do that a lot because, if you don't ask, they're not going to tell you.
Right. And that really
they will not tell you.
That really lines up to one of our, you would hear me say it a lot in Keep Living Your Right Mind. Don't be passive when it comes to caring for your loved one, when it comes to asking those questions of your physicians and figuring out, are there other resources, other opportunities? Hey, is there another type of prescription, generic that you could prescribe to me that will also benefit me, just like the one that you prescribe? You need to ask different questions like that and don't be passive so you can have all the knowledge and information you need to know. This is so, this is good.
It's definitely, and then if for some reason you're not able to get it based off of your income, there's state pharmaceutical programs you can call based in your state. And then also another way we go is I do Good RX search.
Yes.
I've done that for one of my clients. We've done a good RX, got her, I think we paid $3 for a drug that was supposed to be $100 and something dollars.
That in the past before.
I have some good RX cards I give to my clients just in case for some reason, because I do it for myself too.
Right.
And then also try going on the website for the manufacturer. A lot of times the manufacturer, you go on there and you can search, you put in your drug name. They may have coupons or maybe have a program. If you've been prescribed that for so long, then they will cover it. Quick story, I have dry eye. As I gotten older, stuff going on with my eyes. It doesn't lubricate as well. So the ophthalmologist gave me a particular drop, and it was new. It's a new something, whatever. And so she gave me a coupon, but she gave me some samples, and she prescribed it. And I sent it in to Walmart. They $600. It's a box of them, and I'm supposed to do it. $600? Are you serious?
Right.
Okay. I mean, what are we doing here? So I remember, she gave me the coupon, but the coupon also had some more information about you can call in and see if the manufacturer will take care. You can get them for free. And I didn't pay attention at the time, but I paid attention once Walmart come calling me saying you can pick it up and it's $600. I said, no ma'am. So I called the number, did everything I needed to do for it. And then, no, I went on the website to do it. I went on the website to do it. And once I did everything, put in the number and everything, I got a coupon to take to the pharmacy that was supposed to be $0. So when I got to Walmart and I said, hey, I just did this or whatever. And they put in everything, put in the code, $0.
Wow.
So it's stuff like that. Not just me, it's happened for my clients as well. That's again, the manufacturer does it because they set aside so much money for the public to give back because they make so much money off this stuff. This is the U.S. So don't be afraid to ask questions. Because a lot of time the pharmacy folks, the pharmacy technician and stuff like that, they may know stuff too, and they can tell you as well. But please do not take a back seat when your healthcare, like you said, speak up because they just going from patient to patient, and you know what you need, so you're gonna have to ask questions, and you can also ask your agent too.
This is good, you all. If you have any questions while we're talking about Medicare, please post your questions in the comments and we'll try to get to them. If we don't get to them during this live, we'll be sure to answer your questions after the live. This is good information, Bridgette. We're going to continue the discussion, but I really want you to know as well to always join me right here on Keep Living in Your Right Mind. I do broadcast 12 p.m. Eastern Standard Time every Saturday from We Empower Nation. So if you haven't joined We Empower Nation, go over and join We Empower Nation. It's a very awesome group. They have different programs that are broadcast daily and weekly. The We Empower Morning Show, the Fab Five, is just awesome. So please remember to tag someone and let them know about the wonderful programs that are going on We Empower Nation, and let them know to join Keep Living in Your Right Mind, where I'm here to encourage you daily to make sure that you are taking care of your well-being, that you're making the safest and best decision for your loved one, and that you are also creating a support system. Okay? So if there are any questions, go ahead and post your questions. Let's see if there's any questions. Thank you, Donna. Donna says this is extremely helpful information. We appreciate that, Donna. Thank you for joining. Donna is also a good supporter of Keep Living Your Right Mind, and we like to support her business as well, Step to Health. Okay,
yep,
Donna?
I gotta get back with her too.
Yes. So you have any other questions? I thought I saw
yes, I was looking at make sure
T watching. Our Aunt T was watching. I see some more people on here watching. So if you have any questions or any comments that you want to share, go ahead and share those right now as we get back into this topic, Medicare. So tell us some, if you have any other stories to share or examples to share that you know that would help those out here who are caring for their loved ones?
What I can say, I'm running into a lot right now is that you have a lot of family members that are taking care of their loved ones that have Medicare, and they have no clue of what's going on.
Right.
And what's going on is that they have the same plans they've had for quite some time, and it may not be servicing them as well in terms of there are a couple, especially Advantage plans, that have benefits that give assistance in the home for, like, sitting with your loved ones.
That's good, you all. Listen,
The reason why I say, because I'm like, it's some things I listen to my clients, especially the ones that are taking care of their family members. So what is it that you need? Okay. A lot of times they need food, they may need the services of, someone coming into the home, doing some chores, running some errands, fixing some food, any daily living type of activities. And then you have some that will basically take care of, like, especially I'm big into nutrition and wellness right now.
Yes.
So you have a lot that they take care of that. And if you're homebound, you can get a wellness box, a physical wellness box to come to your house. And then also they have live videos, and even you can play them back, YouTube videos and live videos. You can do chair things. So it's like, it's a way, even though they may be bound at home, can't get out, you want to try to figure out how to move them.
Yes, yes.
But this gives you assistance to do this. And I'm big on that because it's like, if you stay immobile, things will start happening and you're going down.
Yes.
And the reason behind all these benefits on these plans is because with anything with insurance, like I said, I've been in insurance a long time, is to help folks get off, to lessen claims. Let's just
claims.
To decrease the amount of claims, but at the same time, it's geared to help you with prevention so that you can help yourself, get healthier lifestyles. That's why all these things are in place. Food cards, gym membership, dental. Dental affects your whole entire body if you did not know that.
It does, yeah.
So these are the things, the reason why these things are here is to, help folks with healthy living, which will drive down claims and also drive down, health conditions. So
how do they apply for that assistance in the homes? How do they determine if they're eligible for that?
It depends on your plan. It depends on your plan. But like I said, normally I listen and get information from my clients to see kind of where they're at. Would this make sense for them? Because you may not need that, and some people, they may need it. So it depends on the plan that you get. And then also normally, when that is one of the benefits, they may say you have to have a certain condition, and it kind of runs the gamut. And normally most folks, either you can have hypertension, heart disease, lung disease. I mean, it runs the gamut in terms of, what cholesterol issues, things like that. So there is, they'll give you a running list, and it's a big list. And normally, just like I said, it's not simple, but just one of the ones that you would think, high blood pressure. Right. A lot of folks are affected by high blood pressure. So then hypertension. So then you can get it. So it's things like that you will see that they will allot you some coverage for getting someone to come in to help with some things. But when I was talking about applying for Medicaid, those policies are normally called dual plans, because you Medicare pays first, and then after Medicare, then Medicaid will come in and take care of everything else.
Okay.
And those are real robust, because you know, depending on your level, you normally you pay zero for everything, because it's being taken care of. And you still and you still Medicaid and Medicare, but you still are able to get similar benefits, dental health, gym, all that type of stuff. And I just, I'm making it a habit to remind my clients to utilize their benefits. Is there? Use them. Use them.
Yes.
You know, it is no reason not to. You know, and this is why I'm saying a lot of these plans end up beating out employer coverage if you're still working, because most employer coverage are not going to give you all these added benefits. And then transportation, you know, some transportation services, some of them pay 24 one-way trip, 36 one-way trip. I mean, it's just the gamut. But for 2024, I can't discuss plans until October 1st. The stuff that they're adding is just, it's a lot.
That's
every
awesome
year is this
to
new
know
stuff.
that they're adding additional options to help you care for your loved one. We do have some questions. Let's go to the questions in the comments. Bunny is asking, does Medicare provide any coverage for senior medical alert system?
Thank you, Bonnie, for that question. Yes. Certain plans, Medicare Advantage plans, do cover the medical alert system. Yes, they do. And certain plans also have provisions in there for alarm systems.
Okay.
I mean, they have lots of things, especially they're big on fall prevention. And one of our vendors talked about that.
Yes.
But they do offer that, but it's not every plan. It's just certain plans. But if that is something, especially if you have a person, your loved one that possibly likes to get up and wander, you may want to, or, you know, they've had issues with their limbs, you know, things like that.
Or memory issues.
Yes. And a lot of, you talk about memory issues. Some plans have where brain IQ services to help with them to exercise their mind, their memories and things like that. And they'll work hand in hand with that gym membership. They have stuff like that. But yes, we do have medical, but it's not on every plan. It's just on certain plans that they do have those. And it's a couple of other
when you talk about it's on certain plans, you mean plans as part of the Advantage?
Yes, the Medicare Advantage plan.
Okay,
yes, because those are the ones that are going to be more robust. That's going to have all the value added. They call them supplemental benefits. Value added benefits. Now, the original Medicare, again, you will not have that.
Right.
Nope.
But you have to add that part C.
Yes, the Advantage plan. But yes, they do. And not all plans, but certain plans. But if that is something that you know that you feel like your loved one or you should have, then, you know, tell your agent. And then they can search that type of supplemental benefit for you.
Awesome. We have another question here as well from Carol. Are premiums monthly?
Yes, they are. For your Part B, yes, they are. And you have they can bill you directly, or you can have it directly taken out of your Social Security check. Some people, thank you for that. Yes. So and normally when you first start up, it will be 3 months before you get that bill. So be careful. Make sure you got your money, because you know they're going to come. They may not, because that's just their billing. And then after then it will, and then also, even if you decide for them to take it out directly, same process. It takes 3 months. And that'll be a chunk, so make sure you still have that in. But that's strictly for your Part B, if you got to pay your Part B premium, if you don't get a special, program, the Medicare Savings Program, that you will be paying that Part B premium every month. And then if you had if you did original Medicare and added a Part D plan to that original Medicare, then you'll have a separate payment because I've had people that came to me that they had original Medicare, plus they had a supplement, which you can do a supplement, which will do similar to what Part C Advantage. Some people do a supplement that will pick up that 20%, and then they also have a separate Part D, but that's a lot of, and then they may have added them a dental, and it's a lot. I've seen it may be $300-400.
So, okay.
It just depends on your lifestyle, what you're doing. And a lot of those supplements, they do cover if you travel. But if you travel, there are some plans on Part C that cover if you travel outside of the state. And normally they will pay for emergency, but just for you to see a doctor, probably not. But that's something you can talk with your agent, or if you would like to speak with me, you can speak with me about it too.
Awesome. This is good information. The supplement part, there is, that's good to know, because I didn't know about the supplement part myself.
Yep.
So you can add that on in addition to your Part C.
No, only with original Medicare.
Okay, so with original
Medicare,
you have a supplemental.
Yeah, original Medicare, you can add a supplement plus a Part D prescription drug. But with Medicare Advantage, because it is pretty much a bundle, you can't add a supplement. That's against the law, and it'll be dropped anyway. But you can't but you can do it with original Medicare, a supplement, and a Part D prescription drug plan.
That's good to know.
Yep.
You need to make sure. You need to make sure today that you get in contact with Bridgette and you reach out to her. I'll list her contact information, her Facebook information, and set up an appointment. Open enrollment is coming up, and you need to make the best decision for you and your loved one. And so again, like she stated, you may have options that you don't even know about. So there may be things that you need to change, going forward if your loved one is receiving the Medicare benefits. Good questions. Any other questions? Let's see if we have any other questions out there. This is good, Bridgette. Thank you so much.
Very good.
Thank you so much for doing this.
I'm going to touch on one more thing before we roll out.
I can't see any comments right now, so yeah.
Because we're about to get into the annual enrollment season, you're gonna possibly get some calls.
Yes. Those calls start rolling in.
They start rolling in, even if you're not of age, because if it was a number previously with somebody else that's around, and then the commercials
and the emails start rolling in.
And the emails.
Yes.
So my brokerage that I'm with, my field marketing agency, we have created a campaign that I've been talking with folks is, are you receiving calls and what to do, of course. Are you frustrated about it? So what happens is they should not be calling you before 8 a.m. or after 9 p.m. And you also have the right, tell them stop calling, but we're helping you to get on the do not call list, because if they violate it, then you can report it to the FCC. You just need, to do date and time and try to keep up with that information if it's the same number continuously calling. But this is a step-by-step process of what to do, and I've been speaking at my different communities and things about it. But if you want a copy, reach out to me, because we don't want people harassed. And the reason being by this, because a lot of times seniors have been given their information over the phone, and it's been used for fraud, or they've been changing them to plans that do not serve them in terms of them not covering their doctors or their prescription drug coverage, and they thought that they were in a plan that was going to serve them, and then it turns out they switched them to something that they had no business being in. So it goes beyond just the calls, but seniors giving information to folks, empower them to do things that they should not have done for them that have messed up their coverage. So it's important, to make sure that they're not giving information over the phone, because a lot of times we've heard seniors say, well, I said yes, I said this, and they may record this a little something of them saying yes or the permission and using it for something else. So it's horrible. It's very horrible, and that's why we have a lot of regulations as Medicare specialists that we have to adhere to because of a lot of fraud.
That is good, because you know that once your loved one starts aging, they are just so vulnerable sometimes, you know, and they will pick up the phone or answer the phone, or if someone says they calling from Medicare or calling from a government agency, they trust them saying that and not realizing they may get ready to get have fraudulent activity. And so that's good to know. I'll post that as well so we can share that information with you all, and that you go ahead and start having those conversations with your loved one. Of course, if your loved one is still mobile and you know you can still explain things to them at a certain level, go ahead and have those conversations with them so they won't give out their their personal information.
Right.
That is good. Are there any other comments or questions? Sometimes it happens, on live. I can't see your comments. So if you can continue to see us and you enjoying this show, just go ahead and type in Medicare 101 or type in Keep Living, or, so we can know that you are still here with us and that we can see your comments. And if you have any questions that we did not get to or I just can't see, please post those again, and so we can answer your questions. But Bridgette, can you just go ahead and just give us a quick summary of what you discussed today?
Sure, absolutely. So again, what is Medicare? It's a health insurance program, federal program for folks that are 65 or older, or folks that are 65 and younger, below that point, with disabilities, with certain disabilities. Of course, if you have ALS, which is Lou Gehrig's disease, and end-stage renal disease, you get it as well at any age. But you have two options of Medicare. You can do the original Medicare, which is Part A and Part B only, or you can go the other route of getting a Medicare Advantage plan, which is Part C, which encompasses A and B, and some of the Advantage plans also cover Part D, which is prescription drug. Again, important point to make. Thank you. These braces. I'm sorry, y'all. I'll be tripping over. An important point to make is that if you do not get Part D with original Medicare when you first sign up, you could face a penalty. So you have to, with original Medicare, you have to add a Part D, which is prescription drug. But the Medicare Advantage, which is the C, those plans normally have prescription drug coverage in it. If it doesn't, you need to, make sure you get what you need, especially if you need prescription drug coverage. And then also, don't shy away. Again, I want to point out Medicare savings plans. If your income is below a certain level, it's worth it to apply to Medicaid. You can do it online or go to your local office. Health service offices to apply for Medicaid, because what can happen is Medicaid can help pay your Part B premium that you are obligated to pay, and also possibly get you eligible for prescription drug savings as well. And of course, your Part A is your entitlement, meaning when you're working and you got 10 years or 40 credits, 10 years or 40 credits, you get premium free Part A, and that covers hospital coverage. And then your Part B, of course, that is a premium. Right now, if it's $97,000 or less as an individual, you will pay $164.90 in 2023. If you're married and is you below $194,000, it'll stay at that $164.90. Beyond that point, it goes the gamut based off of your income. And yes, you will, even with Part C, you are still obligated to pay your Part B premium. And then of course, make sure you get a prescription drug coverage in there I think that's pretty much it that we covered. But again, the Part C is going to just remind you, it's a little bit robust, reminds you of an employer plan where you're getting like a bundle, where you're getting dental, vision, hearing, things like that. And then some of these plans will give you some additional benefits, whether it be a food card, gym membership, home health care, additional home health care services. But that just depends on the plan as to what they may offer. But again, that's Part C. You do not see that in the original Medicare Part A and B, okay? But if you have any questions and still it's not clear to you, please reach out to me.
Yes. Please take advantage of Bridgette and all of her knowledge and expertise in this area. And don't forget, you all, we want to make sure that we continue to support each other. Bridgette is a financial specialist, so she doesn't just focus on Medicare, but she can provide you other options, helping you create a budget. She can help you with all your finances, okay? Mm-hmm. So make sure you reach out to her and support her in her business. This has been a very good session. And here on Keep Living in Your Right Mind, the focus of this platform is to make sure that you, as the caregiver, is taking care of yourself, that you're prioritizing your self-care. So share with us, Bridgette. I'm going to call her 4 a.m. That's going to be her new name, 4 a.m. because she wakes up in the morning and starts her self-care at 4 a.m. So I know we have talked about Medicare, gave y'all all the options, and hopefully you can make the best decision. If you can't, contact Bridgette. But Bridgette, tell us about your self-care routine.
Sure. I don't know if you all have ever heard of PCOS, polycystic ovarian syndrome. Mm-hmm. I have PCOS. Mm-hmm. So basically it's an endocrine type disorder where my hormones and I have cysts on my ovaries. And so what it happens is it wreaks havoc on you in terms of it mimics if you think about if you're a diabetic. Okay. My insulin, I have an insulin resistance. Mm-hmm. And so it runs a gamut of some things. It can cause infertility, which I did have trouble having my daughter and things like that. But also I have to make sure that I keep my A1C, which monitors the sugar in your blood, to a certain level. It's extra hard for me to lose weight. So I have to figure out things that's going to help me. And I was diagnosed like in my 20s, and I'm 48 now. Mm-hmm. So it's been an ongoing thing. However, when I did get serious some years ago, I lost weight and long story short, pandemic happened. Mm-hmm. I gained some nice bit of pounds back.
We all did.
And got off track because I was an advocate. I did high intensity boot camp. I walked, I rode my bike, I did all that stuff. But I kind of got complacent at home, started trying to, I'm trying to support the local restaurants, businesses. I supported them a lot, and it was a lot that I put on. So anyways, from that being said, I started walking, but I need a higher intensity workout for it to drop the pounds that I need. So I knew I was busy back working, thankful, but I didn't feel good in terms of the way I was feeling, some pounds on. So like she said, in July, I started working out with a trainer, and I go at 4:30 a.m. in the morning. The reason why is because I tried to go in the afternoon, I tried to go during the day, but I always end up had some type of appointment. Mm-hmm. My daughter is involved in stuff. Then I'm trying to cook dinner. So those times it was sporadic. And my trainer, where you at? He called me, where you at? What's going on? And I'm like, I'm paying this money and then I'm not showing up. So he had a 4:30 and I said, you know what? I'm just going to have to do 4:30 and just kind of, I know it's TMI, a lot of information, but I'm going through perimenopause as well. So I was having insomnia. So I was getting up at 3 and 4 in the morning anyway and couldn't go to sleep. So I was like, well, I might as well go work out. And so I've been working out consistently with him since August, going at 4:30 a.m. in the morning. And it just works because I have no distractions. Nobody's up bothering me, asking me to do this and do that. And so I just do it. And then now I actually can go to sleep because I'm literally, my day, once it go, I may get home and maybe have a short nap after I shower and everything, but then it's time to take my daughter to school. Then it's my work day. So at least I've gotten it out the way. Yes. And it just works a lot better. But that hit, and I'm doing weight, strength training, that works for me. And it may not work for everybody else, but I know that works for me. And so, so far I'm, about 8 pounds, and I'm keeping them moving. It's going to be a process, but I'm happy and I feel good. And I've just taken that. That's why I'm like narrowed down. I'm doing Medicare and the life for right now because I have to focus on my health because it was inching back up. My A1C was inching back up, and I desperately, I do not like to see that because that's moving me closer to the diabetic range. And I don't want, because when I was pregnant with my daughter, I had gestational diabetes. And, I had to, take my ketos and all that, and I was just like, I cannot, that's just too much. And so I prefer to monitor it with my nutrition and my physical fitness. And so that's where I'm at now. And that's what I'm doing. And, it's working so far, and I feel so much better.
And you look good.
Thank you.
Okay.
Thank you. I appreciate it.
Yeah, she came in here. I was like, look at you. Okay, looking good, dressed good. And y'all, her skin is so pretty and clear. Okay?
Well, that happens when you're working out, too. And then I'm drinking my water.
Right.
So, and I'm juicing a little. You got to watch juicing. Too much sugar. It's natural sugar, but too much. But especially for me, because I know. And that, again, what I tell people, don't just listen to what I'm doing. You can listen, but you need to go to the doctor and get what's going on with you.
What's going to be
best for you. Yeah. And I know what, by seeing, my endocrinologist and everything like that. So I got a couple more pounds to go, and that's fine. But I always like to have that cushion so that I'm not right there with the diabetic range. I kind of try to stay away. Because the older you get, it's just easier for you to get to closer to it. And I really don't want to have to rely on drugs.
Right, I was going to ask that, because you say you see your endocrinologist?
Yeah, I normally would see him like once a year, but once I got to the point where I was doing, my blood work was good, she was like, unless you have a problem, you don't need, but I still do my physicals every year.
Okay, so are you on Synthroid or anything?
No, when I initially was first diagnosed, when there was the issue, especially when I wanted to have my daughter, they gave me metformin. And it just wreaked havoc on me. And that's when I was like, I cannot do it. And then I had a sun sensitivity, which ended up making me break. And I was like, I can't do, I just, what are my options? What can I do? And for some people it works. Some people do Ozempic and, stuff like that. But I'm just not good with medication in terms of remembering to take it. And then what can I do naturally? Right. And that's just me. Because some people, you do need something to help you. And I'm not against that. But I was just going with what was working best for me. And what has worked for me over the years has been my nutrition, just, watching my sugar, knowing when to eat certain things, carbs, before the end of the day so it can have time to burn up doing. So it's just things that I had to learn. But no, I'm not on any medication. I'm just doing it with exercise and nutrition. That's it.
Well, that's awesome. Well, keep doing what you're doing and keep encouraging us and inspiring me as well. Because I need to start back walking. I was walking in June, July, getting ready for my celebration, you know, getting all fine. I was just out there walking.
And you look good, girl.
Right, and then I had the celebration. And
then you threw it.
Right. And the streets ain't seen me walking in a minute, okay?
And see, that's another thing.
But I have to start back. I have to start.
You got, and I'm also, I call it Operation 50. I will be 50 in 2024. So I'm like, this gives me enough cushion.
Yes.
That if I flip out, that I can come
You
back.
can come back, right.
But right now, I've gotten addicted to it.
Yes.
I'm used to waking up Monday through Thursday.
It's awesome. I see you post, and I'm like, I was probably, you know, my third or fourth trip to the restroom at 4:30 in the morning.
Yeah.
But she is up and getting it in. So that is awesome, awesome, awesome. But I tell you, it's been a great show today. I'm glad that you all joined us today. Again, share this information. We will post some answers to some of your questions. And then again, like I stated, reach out to Bridgette, contact her, take advantage of her expertise and support her business, okay? And next week, you all, we're going to have another guest on Keep Living in Your Right Mind. Look for that announcement and post. We're going to have Bunny Roach. I believe she's still watching, and she's going to share with you her story as a caregiver. She cared for her mom for many years, and also she's an author. So look for that announcement, and we'll have that broadcasting for you on the 30th of this month. So thanks again, Bridgette. I appreciate you so much. Bridgette is always supporting Keep Living Your Right Mind. She's always got my back, always telling me, good information. And you always need good people on your team.
Oh, yes.
Okay?
Yes.
You always need good people on your team. So I appreciate you. And thank you all for watching, and enjoy your day. And keep living
in your right
in
mind.
your right mind.